Hi friends, today I'm going to talk about high blood pressure. എല്ലാവർക്കും അറിയാവുന്ന ഒരു കാര്യമാണ് high blood pressure or hypertension. Quickly, just a few things I want to mention about it from a doctor's perspective. First off, this year, 2017, high blood pressure in the definition has changed. Okay, according to the American Heart Association and many other medical associations, they came up with a consensus that changed the diagnosis of high blood pressure. Normal blood pressure is less than 120 systolic, the top number, over less than 80 diastolic. Okay, but the pudiya change ennu vechu stage 1 high blood pressure, they changed it to anything greater than 130 systolic over anything greater than 80 diastolic. So that's stage 1 high blood pressure. It used to be not like that. Idine mumbu greater than 140 ആയിരുന്നു diagnosis of high blood pressure ആയിട്ട് കണക്കാക്കിയിരുന്നത്. പക്ഷേ ഇപ്പോൾ അവർ ചേഞ്ച് ചെയ്തിരിക്കുന്നു. It is greater than 130 over greater than 80 systolic is high blood pressure stage 1. Stage 2 ആണ് greater than 140 over greater than 90. Okay. So ഒരു പേഷ്യന്റിന്റെ സ്റ്റാൻഡ് പോയിന്റിൽ നിന്ന് എന്താണ് അറിയേണ്ടതെന്ന് വെച്ച് കഴിഞ്ഞാൽ എല്ലാവർക്കും ഇപ്പോൾ അറിയാവുന്ന കാര്യമാണ് ബ്ലഡ് പ്രഷർ ഈസ് സംതിങ്. അത് നമ്മൾ ട്രീറ്റ് ചെയ്തില്ലെങ്കിൽ അത് നമുക്ക് ഇൻക്രീസസ് അവർ റിസ്ക് ഓഫ് ഹാവിങ് സ്ട്രോക്ക്, ഹാവിങ് ഹാർട്ട് ഡിസീസ്, kidney dysfunction, etc. So there is a reason to treat high blood pressure and take it seriously. ഇപ്പോൾ 130 over 80 or more is reason to start treating blood pressure. The other thing I want to talk about is risk factors for blood pressure. There are some risk factors that we can do something about. Chala risk factors we cannot do anything about as patients. First off, our race and our age. Our risk factors, we cannot do anything about it. As we get older, the risk of high blood pressure goes higher. Some races are more likely to have high blood pressure than other races. African Americans are higher likely than white population to get high blood pressure. The other common thing that we can do something about, that's a risk factor, is our body weight. Logam muruvan people are going into obese range now. Everywhere you go, you can see people that are overweight and obese. And that's a completely different topic that we can talk about, but that's related to our diet habits, our inactivity or activity level. And now obesity is contributing to high blood pressure, which is contributing to heart disease early and stroke and things like that early. So obesity we can do something about. Nammada body weight korakkunnathu something that we can do to help with our overall health. Family history. We cannot do anything about our father and our grandfather, etc. If they had high blood pressure, avarku blood pressure undarnengil, we are more likely. So how can we make that into our advantage? If our father or our grandfather had high blood pressure, seek treatment early. Don't, because remember, most patients ഈ high blood pressure ഉള്ളവർക്ക് signs or symptoms ആയിട്ടൊന്നും ഇല്ല. So their blood pressure is high, but അത് check ചെയ്തില്ലെങ്കിൽ you never know until you have issues. I remember treating a patient, I'm going off track, but I remember treating a patient in another country. He came to the hospital for the first time because of severe headache and came back later on about 30-40 minutes later with a left-sided stroke. His blood pressure at the time of coming into the hospital was 260. The systolic was 260. When I was talking to him, he never knew he had high blood pressure before that. Adinu mumbe doctor eduthu poittilla. Appo ee 260 aayirunnu blood pressure, and who knows how long. I think he was around the age of 65 or something over 60, but less than 70 years old. He never knew, and the first time he came to the hospital was with a hemorrhagic stroke. He had a bleed in his brain from high blood pressure. Adhe admissionly we found out that he also had severe kidney dysfunction as well. from complications of high blood pressure. That patient's life was drastically changed essentially that single day. So remember, a lot of patients won't have any symptoms. So if you have a high family history of high blood pressure, if you're 30, 35 years old, check your blood pressure. Make sure that it's kind of under control. If it's not, seek care early. The other thing, risk factor that we can do something about is the salt in our diet. Now, if you go to a restaurant and eat, for example, food is very salt laden. നമ്മളത് salty ആയിട്ട് തോന്നിയില്ലെങ്കിലും it has a lot of salt in it. So what's excessive salt? So the blood pressure guidelines recommend anything greater than 3 grams a day. Okay, that's excessive salt. In people with heart failure, we sodium restrict to less than 1500 milligrams a day. That's because salt again causes worse heart failure symptoms. So that's something we can do to change our risk of having complications from blood pressure is controlling our salt intake. Okay. The other thing that we can do to reduce our risk factor for high blood pressure is the alcohol consumption. Nowadays, people are drinking more alcohol than people have been drinking in the past, and higher amount of alcohol consumption is related to having high blood pressure. So that's something to keep in check. That's something we can change. The other thing that we can do is to decrease our risk of high blood pressure is physical activity. Okay. Studies have shown over and over again that physical activity, this sounds very obvious, right? Nalum, physical activity is very important for our health. And having daily physical activity, okay, is like a stepping stone for better health. It's a stepping stone for improving your cardiovascular health for once, and it also decreases your risk of having high blood pressure, which decreases further complications in the future. So these are the primary main risk factors for having high blood pressure. Now, remember, there is also one thing is there is essential high blood pressure, which is the normal, like high blood pressure എന്ന് നമ്മൾ പറയുന്നത് എല്ലാം is primary high blood pressure. അതുകൂടാതെ there is another thing called secondary high blood pressure. Secondary high blood pressure is high blood pressure due to another disease process. Okay, I won't get into that today, but I want to mention some of the things that are common secondary causes of high blood pressure. Not all of them, some of the things, okay? One of them is sleep apnea. Especially body weight കൂടുമ്പം, obesity കൂടുമ്പം, people have sleep apnea. They stop breathing at night, off and on. Okay. Treating sleep apnea is important because it decreases your risk of high blood pressure. The other thing is, we all take medicines like ibuprofen, naproxen, things like that, Advil, Aleve, all of these things. These are non-steroidal anti-inflammatory drugs. There is a correlation between taking these kind of drugs, regularly and having a risk of high blood pressure. With Tylenol also there is some evidence, but not so strong. What about aspirin? From a cardiology standpoint, we give aspirin to everybody. But studies show that with the low dose of aspirin we usually give 81 milligrams of aspirin a day. With that low dose of aspirin, it's not much of a risk. So things to think about is if you are using non-steroidal anti-inflammatory drugs for pain or back pain or whatever, that can increase your risk of high blood pressure, and it can worsen. If you have high blood pressure, it can worsen the high blood pressure that you already have. Okay, so coming back to it again, obesity, decreasing your weight is important. If you have a family history of high blood pressure, for all the young people, go seek care early so that you will detect problems early. Salt in your diet. It sounds very obvious, but anything that comes from a can has a lot of salt in it. If you go out and eat, it has a lot of salt in it. Most of the snacks that we eat, potato chips, any kind of fried items like that, or even mixed nuts, things like that, are all laden with salt. That's important. High alcohol use obviously causes high blood pressure, and the most important thing also is physical inactivity. If you're having a desk job and you're not getting up all the time, or if you're not going for a walk, make it a point to start walking every day, 30 minutes a day as a start for better health. All right, that's a quick little talk on high blood pressure. If you have more questions on topics like this, comment on this video and we will answer those questions. Thank you for watching.